NHS managers say the pressure on the health service is absolutely relentless, as new figures show waiting lists in Wales have grown for the 22nd month in a row. The latest data shows there are almost 700,000 treatments and operations waiting to be done. Elsewhere, Welsh hospitals have recorded their worst ever figures for A&E waiting times. And although cancer waiting times have improved, they're still not hitting targets. NHS bosses are now warning the impact of COVID will be with us for many years to come. Our correspondent James Williams has the details.
The health system is broken. The NHS is under immense pressure. We cannot continue in these circumstances. Warnings from NHS managers and staff, backed up today by record low performance figures, particularly in A&E.
It's fair to say that a lot of our staff in the ED are increasingly burned out, and morale is a very long-term problem because people are aware that we're not able to deliver the standard of care that we believe our patients deserve.
In A&E departments, the target is that 95% of patients should be seen in less than 4 hours. That target's never been hit, but last month it hit a new record low of 65.1%. Another target is that no one should wait more than 12 hours in A&E. But in March, almost 11,000 had to wait longer than half a day, the highest number ever. Targets are being missed right across the NHS. February's performance of just over half of life-threatening red calls being seen within 8 minutes was the joint second lowest on record. And cancer waiting times improved, but was still below target.
So it's a whole system issue, from accident and emergency, GPs, community pharmacies, but also social care. And what we need is social care. It doesn't just look after people when they are vulnerable. It helps stop people getting ill in the first place. So we need a sustainable social care settlement in future as much as we need it for the NHS, because the two are intimately linked.
Earlier this week, hospitals in the Cardiff and Vale of Glamorgan area paused planned treatments due to a recent increase in COVID patients.
I think we need to debunk the myth that COVID has gone away, because it most certainly hasn't. And the impact it's having on the NHS is going to be with us for years to come.
As it stands, there are almost 700,000 non-urgent operations and treatments waiting to be carried out in Wales, another record high. Barry-based bridal shop owner Jessica Ricketts suffers from endometriosis and has been waiting for a hysterectomy for 3 years.
When lockdown hit, I sort of had to get used to the fact that it's not going to happen this year, definitely not this year, but it will be next. And that obviously didn't happen at all. There's not many days where I'm not in pain. I'm in pain right now. Every day there's something, some sort of symptom, whether it be fatigue, sickness, pain, bleeding. There is a symptom that is happening on every day of every month.
Next week, the Welsh Government will publish its long-awaited plan to deal with the huge waiting list backlog. But NHS bodies are saying it won't necessarily address one of the main issues, a shortage of doctors and nurses.
We need to redesign roles around them. We need to make the best use of the teams that we've got. We need to keep recruiting. We are training more people every year. We got more people working in the NHS now than we've ever had before. But we continually need to be making opportunities to use the staff we've got and to provide opportunities for them to work differently as well.
But in the meantime, Jessica Ricketts and thousands like her continue to wait for treatment from an NHS under immense pressure.
James Williams there. Now to Westminster.